So, Mr. Prince, how are you feeling now?
Too good. Very
I think it has
wonderful.
been like 1 month
Yeah.
now?
1 month or like a week.
1 month and a week.
Yeah.
So, how much you have lost in this time?
8-9 kgs.
8-9 kilos.
Yeah.
Okay. So, could you tell us about your experience during surgery, after surgery, and during this 1 month? What all problems you faced, and how do you rate this surgery out of 10?
It's a wonderful thing actually. I had faced no problem during the surgery or after the surgery. It was like I cannot say that I had any pain or something like that. But still I had a little bit problem of eating or something. But obvious, like if you change something in your internal system, you'll have to. But still, that's not a big drastic change. But now the thing is, my life has been changed, absolutely a drastic change in my life. Now I can walk like 5-6 kilometers, and I can like climb the stairs to 4th or 5th floor very easily.
Okay.
And I'm feeling very light before.
Okay.
Yeah.
So in 1 month you are feeling these changes.
Yeah, of course.
What we see is like in the coming 5-6 months when you lose significant amount of weight. So that is the time when your life will be totally changed.
Yeah. Okay.
Now our point of concern in most of the cases is because it's a fresh case and sometimes patients cannot eat much. They have some vomiting, nausea. So what is your feeling about that? How much you can eat in one go? If we see by Indian system, can you take 1 chapati?
Yeah, of course.
In one go you can take 1 chapati?
I can.
Easily.
Easily.
Okay, and what about chicken pieces? You can take 2 or 3 chicken leg pieces?
Yeah, of course. With bone pieces, I can like medium size 2 or 3 pieces.
Okay.
Yeah.
Why I am asking this question is that this surgery which we did in your case, Dr. Ratwaj was also there, we have done mini gastric bypass. And mini gastric bypass, the special thing about mini gastric bypass is that we make a big pouch, which gives you some luxury to eat.
Alright.
Whereas if we compare it with old surgeries, the pouch used to be very small in the old surgeries. It used to be 30 cc pouch, and yours is like 200 cc pouch. And that is the reason why you can eat. Within a few days of surgery, you started eating.
Yeah. I think I started in like very second or third day.
Yeah. So this luxury comes with mini gastric bypass only. Otherwise, in the old surgeries, we used to recommend like 6 weeks of liquid diet.
Alright.
Clear liquids for 6 weeks, which used to be very difficult for patients. Many of the patients would, even get scared with this idea that after surgery they have to be on liquid diet for about 1.5 months.
Yeah, it's but obvious. Even in this surgery, you'll be starting eating a very small amount of food and all that.
Yeah.
It's like a phobia in your mind. What is going to happen with me?
Yes.
If I'll not have like 4 or 5 chapatis, I'll have to stack it on just on a 1 chapati
Yeah, but
or so.
what do you feel after eating 1 chapati? Do you feel like having more, or you get satisfied, or you feel that you cannot eat what you want to eat? What happens? You are satisfied?
No, my stomach tells me that now it's better you should stop it.
Okay.
Yeah.
But still you feel like eating more?
No.
Okay.
But when I
You
start, like pick up a plate or something, any food, then I feel like I'll have a lot of food. But
Okay, I will have
have this much, and I'll have 2-3 chapatis and all that.
Okay.
But like after having a 1 chapati,
Yeah.
my internal system tells me that no, it's okay, fine, you're okay with that, and
Yes.
stop it.
For that, you should go very slow, chew well, and go very slow. Take time. On 1 chapati, you should spend at least 20 minutes.
Of course, I've
Don't go
started
fast.
enjoying the food right
Yes.
now I'm started enjoying the food.
That is the best way to deal with mini gastric bypass. Obviously, we have to give some restriction, otherwise you don't lose weight. But you have a long bypass of 180 centimeters.
But I have to eat like very frequently, after like 3-4 hours, a small amount after 3-4
In the
hours.
first 2 months, you must eat frequently, because otherwise you will start feeling some kind of weakness or certain blackouts, because we don't want you to come down very fast.
Okay.
Weight loss should be slow and gradual. You see the amount you are eating now, if you compare it with what you used to eat earlier before surgery, there must be some drastic difference in the amount of
like
volume.
I think it's like I have reduced my 80% of the diet.
So if you are taking only 20% of the diet, that means you will definitely lose good amount of weight. But
now,
still,
now
you are eating.
I consume like the one meal I used to take before the surgery.
Okay.
Now it's distributed in the whole day meal.
Whole day.
Yeah.
So that's good.
Like
So-
I have skipped my 3 or 4 meals
Okay.
before.
Yeah.
Now I have come to just one meal. Let's
Yes.
distribute it in the whole
So
day.
that,
24 hours.
you're, I think you are
Yeah.
doing very good. Everything is going on well. You must chew well, go slow, and
Yeah.
don't take much of sweet liquids or other sweet things like chocolate, candies. You must avoid this. And do not do smoking.
No.
Smoking doesn't go hand in hand with mini gastric
Yeah.
bypass. It can give you ulcer. And start some kind of exercise. Better if you
I have-
start
I
some cycling,
Yeah,
then the speed will double up, the weight loss.
Okay.
If you don't do exercise, then it will go very slow. So if you want to,
like
you
I have
know,
to
be quick,
make my
then-
metabolism good.
yes,
Oh,
yes, that's a must.
No,
So-
then I have like no problems with eating and all that. Still, sometimes I do feel that I cannot eat as much as I used to, or
Yeah,
like I had a habit of eating a lot of food since like last 40 years.
but that's what brings you to me. If we don't fix that, then that's not the solution. But you must be seeing some fat floating
Yeah.
on the toilet seat.
Yeah.
So that oil which is coming out of your
Every
body.
day I'm
yeah.
like whenever I go to toilet or whatever, I examine my stool
Yes.
and it's like some oily sort of thing
That
floating
comes
in the
out.
water. Yeah.
So earlier that was getting deposited inside your body. Just imagine. So it was like every day, 1 or 2 spoonfuls of fat were getting deposited inside your body, which is now actually coming out. So that's what would bring you down, get you. Down. How many inches you have lost?
I'm not sure about. I haven't measured it.
What
actually.
about your belt?
But I have like seen that I had 2-3 jackets or clothes are getting loose. Like even you can see this thing was like
Yeah,
not
this
going to
Yeah.
was not fit for me, and I had 2-3 jackets. Those were very tight to me from here. I
Okay.
cannot close my zipper.
Now it fits.
Now it fits. Yeah.
That's good. All the
Even
best.
like on you can see on my hand.
Yeah, now we can see the veins now.
and all that.
Earlier the veins were not
there's
visible.
even
yeah.
on my feet also.
Okay,
Yeah.
that's
My
good.
shoes are getting loose,
Mhm.
and my even from my hands.
That's good.
But, yeah.
And you must take 1 tablet of multivitamin every day.
Yeah, I do it. Yeah.
Don't miss that.
Okay.
All right. See you again. You can come after 1 month again.
Yeah, of course.
Yeah,
I do.
that's good.
Yeah, fine.
All right.
All right.